Hello guys, this is Adib. Welcome to my channel Movement Science where I simplify biomechanics with Joe. Speaking of Joe, I can't see Joe over here today because he's shy. You know why? Because I convinced him to strip in front of you guys. Yes guys, you heard it right. I asked him to strip in front of you guys so that you guys could understand how the kinetics work. That is the insertion and origin of the muscle and how they bring about the movement in the knee joint. So stay tuned for that. In this video, I am going to cover the flexors of the knee joint, their insertion and origin in brief, what functions they carry out, and also we will discuss how gluteus maximus and soleus can bring about extension at the knee joint. Yes, the muscles that don't even cross the knee joint can bring about extension in the knee joint, and we'll see how that happens. The reference time for all the topics that I'm going to cover will be mentioned down in the description. So let's get started. So we will cover the 8 knee flexors in this topic, and we will also discuss about their insertion and origin. So the knee joint has 8 knee flexors, that are the 8 muscles that cause knee flexion at the knee joint. So that you guys remember these muscles better, I divided these muscles into certain groups. But before that, first of all, let us see the 8 flexors, that is forming a 8 over here. So that's how you remember that there are 8 knee flexors, because they kind of form an 8 on the posterior aspect of the knee. So let us divide these muscles into different groups. There is the hamstring muscle, which has semimembranosis, semitendinosis and biceps femoris. And then there is the SGS, that is the semitendinosis, gracillis and sartorius. Then there is also the popliteus muscle and the plantaris muscle over here, and then there are the 2 gastronemius muscles. So let us dive deep into it. So coming to the hamstring muscle, hamstring has a semimembranosis muscle, which is over here, semimembranosis, which is on the medial side among the hamstring group of muscles. Then there is the semitendinosis, which is slightly on the lesser medial side, that is over here, the pink color. And the other one is the biceps femoris, which is on the lateral side, which has the 2 heads, that is the long head and the short head. Let us see how this looks on Joe. So guys, now Joe will have to strip.
They ask you how you are, you just have to say that you're fine when you're not really fine, but you just can't get into it because they would never understand.
So if we look on the posterior aspect, these are the hamstring muscles, and the most medial muscle is the semimembranosis, that is on the medial side over here. The semimembranosis takes its origin from the ischial tuberosity and attaches on the medial aspect of the knee joint, on the tibia. Okay, over here like this. Then comes the semitendinosis, which is lesser medial, and it has origin from the ischial tuberosity again, and it attaches with the SGS muscles, that is over here you can see semitendinosis is there in the SGS group, forming pes anserinus, which we will talk in a while. And then on the lateral side, there is the biceps femoris over here, which is the long head, which also has the same origin, that is the ischial tuberosity. And then there is the short head, which attaches more medially to the biceps femoris over here. And it does not cross the hip joint, that is, it does not take its origin from the ischial tuberosity, it takes its origin from the femur. So these muscles together form the hamstring group of muscles on the posterior aspect of the leg. Now going to the medial side of the leg, there is the SGS muscles, that is the semitendinosis, gracillis and sartorius. So these 3 muscles have their attachment on the medial side of the tibia, and it is called as the pes anserinus, also known as goose foot, and it provides dynamic stability to the knee joint. Let us see how they are attached. So on the medial aspect of the leg, there is the gracillis, which takes its origin from the pelvis and attaches on the medial side of the tibia like this. Then there is the sartorius, which starts from ASIS over here, ASIS, and attaches again to the medial aspect of the tibia like this. So this is called as the anterior superior iliac spine, that is the ASIS. Gracillis over here from the medial side, and posteriorly the semitendinosis comes and attaches over here. So these are the three muscles that come and attach over here on the medial aspect of the tibia, and the attachment is called as the pes anserinus over here, pes anserinus. You can see over here on the medial aspect of the tibia there is the attachment, and it looks like a goose foot, that's why it's called as the goose foot. The other muscles are the gastronemius, which is on the posterior aspect of your leg. So if you see over here, these are your gastronemius muscle. There is the medial head and also there is a lateral head. So these are the two heads of gastronemius which attach on the femur. They cross the knee joint like this, and they attach at the calcaneum through your Achilles tendon. Then going to the popliteus muscle, which starts from the lateral aspect of the femur and attaches to the medial aspect of the tibia, and it causes medial and lateral rotation over here, and it is involved in locking and unlocking of the knee joint. And lastly, the plantaris muscle. Plantaris muscle is somewhere over here like this, which is a very thin muscle and it's absent in some of the people. So now that we know all the muscles, that is a hamstring which has semimembranosis, tendinosis and biceps femoris with long and short head. SGS, that is the semitendinosis, gracillis and sartorius. And also the popliteus muscle and gastronemius and plantaris muscle. Let us see the function of each muscle. So a general rule is that whatever structures are present on the lateral aspect of the knee will prevent all the valgus stresses and stabilize the knee joint against the valgus stresses, whereas whatever structures are present on the medial aspect will prevent all the varus stresses. Okay. So then going to the hamstring muscle. So now we'll take hamstring just as a one muscle over here. So if you can see, it crosses the knee joint and it also crosses the hip joint. So at the hip joint, hamstring muscle causes extension, right? Over here, if you can see, when the muscle contracts over here, it will pull the knee joint and it will cause knee flexion. It will pull the tibia and will cause knee flexion. Whereas when it contracts at the hip joint, it can cause hip extension too. So there is knee flexion and hip extension done by the hamstring muscle. We also know that during knee flexion, hamstring can cause lot of strain on the PCL ligament as it causes posterior translation of the tibia. If you have not seen my video on PCL, go check that out. You'll know how it causes posterior translation of tibia. And also it reduces stress on the ACL because it prevents the anterior translation of the tibia, and that is also explained in my ACL video. So now that we know what it causes strain on and what it prevents strain from, now let us talk about active and passive insufficiency of the hamstring muscles. Active insufficiency is inability of the muscle hamstring or any muscle which crosses two joints to contract at both the joints simultaneously. That means if hamstring is causing knee flexion over here, it cannot cause hip flexion that effectively. Or if hamstring has caused a hip extension over here, it cannot cause knee flexion over here that effectively. So this is called as the active insufficiency, that is the inability of the muscle to contract effectively at both the joints. Whereas what is passive insufficiency? It is exactly the opposite of active insufficiency, that is, it is inability of the muscle to stretch at both the joints. If you stretch the muscle at the hip joint, it's already elongated over here. Now if you try to stretch it even at the knee joint, it will end up tearing, right? So you can stretch the muscle only at one joint effectively. So that is the passive insufficiency. Now, why are we talking about active and passive insufficiency? Why is it important? It is one of the core and most important topics in physiotherapy that you will come across. So if this is your hamstring muscles attaching at the tibia and at the ischial tuberosity, if you want to check the strength of your gluteus muscles, what you will do is you will ask the patient to extend the hip, right? But as we know, hamstring muscle also causes hip extension. So how do you differentiate between hamstring muscle and gluteus muscle? That's where the active insufficiency comes into play. You will ask the patient to first flex his knee. So hamstring over here will become already in contracted state. So then when you are causing hip extension, there will be only glutes which are working, and that's how you can isolate different muscles when you are checking MMT, that is the manual muscle strength. So this rule of active and passive insufficiency won't apply to the short head of the biceps femoris because it is crossing only one joint. Now let us talk about the gracillis muscle. It is attached over here on the inner side of the tibia and the pelvis. So medially it causes hip adduction and also hip flexion, whereas at the knee joint it causes knee flexion, and as it is attached on the medial side it also causes knee internal rotation. Okay. Then next is the sartorius muscle. Sartorius muscle, I said it is attached to ASIS and over here to the tibia. So what it does is it causes knee flexion at the knee joint along with medial rotation similar to gracillis, and it mostly works at hip flexion, that is during the swing phase of walking. While walking, during the swing phase, you can see it contracts over here to cause the hip flexion. And at last we have the gastronemius muscle, which can cause knee flexion at the knee joint, but it's very minimal, and it also causes plantar flexion, which is its main function over here. At the ankle, it can cause plantar flexion of the ankle. Along with that, there is the popliteus muscle over here, which can cause locking and unlocking of the knee joint. But as we learned in our locking and unlocking, that even when the popliteus muscle is paralyzed, we can still see locking and unlocking. So guys, let us now see how gluteus maximus and soleus, both the muscles which don't even cross the knee joint, can cause knee extension. So when you are in a close kinematic chain, that is your body is in contact with the ground, what happens is the gluteus will contract and it will draw the femur posteriorly, and also when the soleus contracts, it can draw the tibia posteriorly. So as you can see, the resultant force will be in the posterior direction, and that's how in a close kinematic chain the contraction of both these muscles can cause extension at the knee joint over here. So I'll take them both into flexion, and as they contract, as both the muscles contract, it will cause extension at the knee joint.
If you like my content, please share it with your friends, like and subscribe to the channel. Hit that bell icon so that you get notified whenever I upload a new video. Thank you for watching.